So let's go through this research. Dose response. That term means like the relationship between the number of chiropractic visits and patient outcomes. I know the word dose is in there. That's what they call it in research. And then we've got frequency of care, which is how often the people are coming in. So there's quite a lot of research on this, and there's a consistent pattern. I'm going to talk about low back pain research and headaches. That's not my jam. That's not my kind of research. I find that a little bit boring. I think that the research that we do with the brain and everything is the sexy research, but this at least has a lot of importance for understanding what we're doing in chiropractic care. So this study, 2014, so it's a while ago, 100 patients with chronic low back pain. And what they did is they randomized these people to either getting no care, or they were adjusted once a week, twice a week, or 3 times a week for 6 weeks. All of the groups that received the adjustments or chiropractic care improved, but we had the biggest peak in terms of improvement at the 12 session one, so that's twice per week, but the 3 times a week had the most sustained improvement. Okay, so they tracked these people over a year and their like pain disability index things, and they found that 3 times a week was the best for those long-term outcomes. Now, I know that I'm talking about this kind of like pain and 3 times a week, and what we have to understand with research is that there's a limit to what we can do each time. So they have capped that at 3 times a week. We don't know beyond that with this research, but you can be very, very clear that 3 times a week had the best outcomes in this study. Then we had the cervicogenic headache. He's done a couple of these. This one was 80 participants, and they had either once or twice a week. They also separated it into adjustments. I know it says SMT, but that's how they term it, adjustments, and light massage. Their chiropractic care was superior, and the best, of course, was the twice a week. Okay, again, that's their limit that they've capped it at. More was better. We have another one. They did this study again with more people, and they added in the 3 times a week, and that was superior. Okay, 3 times a week for 6 weeks. And then they did their 1-year follow-up. How many of you are seeing your people at least 3 times a week for 6 weeks? Now you know you are underserving your people if you're not doing that. Okay, there is a lot of evidence to support that 3 times a week for at least 6 weeks. We don't know more than that. But this is very, very clear in the evidence. There's a lot to support that. Okay, and why? Why is that frequency important? Because you are working with a brain that changes depending on how it is receiving input from its environment and from the body. And the brain changes based on the more it gets in there, and the more input it gets, the more it changes. Okay, that is plasticity. So be very, very sure and very, very clear that you can see people frequently. The evidence supports it. More stuff, frequency of ongoing care. This one actually, they did tons of different clinics around, I think it was the US, lots of different clinics, and they were looking at, it was an observational, so kind of correlating how many times a week did people come and who had the best outcomes. And of course, it was the people that had more than once a week had better outcomes. Again, we're same thing. And then I really like this study. I don't know why there's an owl there, but he's cute. Maintenance care. Another thing that we get hammered about is, why do people have to keep coming back? Well, there was a big study done in Norway where they did this maintenance care program. And what they did is they got people with low back pain, and they asked people to only come in. There was a group where they asked only come in when you are having a pain episode.